Today I'm going to discuss Volition's recent publication with the American Society of Clinical Oncology, or ASCO. We at Volition are very excited about this because hematological malignancies, meaning leukemia and lymphoma, or more commonly and collectively known as blood cancers, are often quite difficult to diagnose because they can present with nonspecific symptoms such as fever, weight loss, or fatigue, which are also symptoms of common non-cancerous conditions like infection, for example. Now, to make a definitive diagnosis of a blood cancer, you actually need to biopsy a lymph node or the bone marrow. So if we have a blood test that can distinguish blood cancer from, say, infection, we can, one, ensure patients with cancer are quickly referred to oncology to receive the all-important early treatment, and two, for those patients who do not have cancer, save them from having to undergo an unnecessary tissue biopsy and help ensure they receive treatment tailored to the underlying condition. With that said, I'd like to show some slides from a presentation that highlight the results of the study we published with ASCO. As a background, there are 700,000 new cases of blood cancers diagnosed each year and approximately 415,000 deaths. Our hope is that an accurate blood test can help to greatly reduce the number of deaths by allowing earlier referral to oncology for treatment to begin earlier. This is a summary of the study design. We measured circulating nucleosomes in a cohort containing 271 solid or non-blood cancer tumors, as well as 25 non-Hodgkin's lymphomas, 25 acute myeloid leukemias, 8 lymphocytic leukemias, and 62 healthy controls. These samples were obtained from patients at the time of the original diagnosis, as well as at relapse or recurrence of the original cancer. We used 20 microliters of plasma, which can be easily obtained from a drop of blood, and for comparison, a drop of blood is about 50 to 60 microliters, and we analyzed it on standard CLSI validated ELISA. Here, if you look at the bottom figures first, you see the median levels of circulating nucleosomes in non-Hodgkin's lymphoma, acute myeloid leukemia, and acute lymphocytic leukemia were all greater than 200 nanograms per milliliter. While the solid tumor level was also elevated above that of healthy patients, only 14 of the 271 patients with solid tumors exhibited levels of greater than 200. And you'll see that the healthy control patient levels averaged only 40 nanograms per milliliter. We've published information on solid tumors in the past, but what was exceptionally exciting about this study was the extreme elevation of circulating nucleosomes seen with blood cancers. They had in between 7 and 14 times the level of circulating nucleosomes than did healthy patients. This suggests it could be a very effective test. In the next two slides, I'm going to show what's called a ROC curve, or receiver operating characteristic curve, which is a mathematical representation of the performance of a test. The area under the curve, or AUC, represents the test accuracy, and sensitivity and specificity, which represent the likelihood that a positive test result equals a true positive and a negative test result equals a true negative. This graph isn't for Volition's nucleosome test, but rather the ROC curve for PSA, which is one of the most common and widely used tests to screen for prostate cancer. This is just used for comparison. If you look at this graph, the top dotted line is for high-grade prostate cancer, and the bottom dotted line is for low-grade prostate cancer. And the solid line in the middle represents all grades combined. And this is included just for illustrative purposes to show how good Volition's nucleosome test performed in blood cancers. If you look closely at the curve, you'll notice that 73.2% of the entire area is under the curve. That means that PSA is 73.2% accurate. Now compare PSA's curve to our nucleosome assay. Again, this is for all the blood cancers versus healthy patients. You'll see that 91.2% of the area is under the curve, meaning this single assay is 91.2% accurate, which is exceptionally good performance. Now, if we set the specificity to 95%, meaning there's a 95% chance that a negative test result accurately reflects no cancer being present, then there will be a 74.1% chance that a positive test result accurately represents a true positive cancer. Again, this is excellent test performance and far better than the widely accepted PSA used for prostate cancer. And lastly, if you see the R squared, which represents variability, is 67.2%. This will make sense to the statisticians, but I'll say that variability is undesirable, and 67.2% is, again, excellent performance. This is a box plot of our test results in healthy versus all blood cancer patients. It shows the actual concentration of circulating nucleosome levels as red dots and the range of variability in the blue boxes. You can see quite clearly that healthy patients have much lower average levels than did the blood cancer patients. And anytime you have a gap or a clear separation between the two boxes, you know you've achieved excellent test performance. This slide and the following slide will show the results of our test for healthy patients versus only the blood cancer samples collected at the time of diagnosis. The samples collected at the time of relapse have been removed so we can understand how the test would perform in the setting of a new, previously undiagnosed patient. Here, our test actually performed slightly better than if you were to include the relapses. 92.6% for the newly diagnosed versus 91.2% for the previous slide when the relapses were included, with a higher R squared, meaning even less variability. This is important because, from a physician's perspective, it's much more difficult to diagnose new blood cancers, or any disease for that matter, when the patient has absolutely no history of having had the disease in the past. Here we see the box plot representation of healthy patients versus those with a new diagnosis of blood cancer. And again, here you see even greater separation of the circulating nucleosome levels, indicating even greater test performance. The last graph I want to show is a ROC curve for our test when we isolate only the non-Hodgkin's lymphoma patients from the rest of the blood cancers. I wanted to show this because non-Hodgkin's lymphoma is the most common of the blood cancers and will most likely be the first indication for which we'll pursue regulatory approval. The takeaway here is that we see an AUC, or accuracy, of 93.9%, which is the best performance of all the subgroups analyzed, and an R squared of 73.4%, which represents the lowest variability of all subgroups. So with non-Hodgkin's lymphoma being the most common of blood cancers and the test showing the best performance in non-Hodgkin's lymphoma, we're very excited about pursuing regulatory approval for this test. So what can we conclude from this study? This was our first study looking at blood cancers, and the results are still quite early in the research and development process, but they're performing exceptionally well and are very promising. As a reminder, we demonstrated an AUC, or accuracy, of 91% in all blood cancers versus healthy, 92% in the new diagnosis of all blood cancers, and lastly, 93% for non-Hodgkin's lymphoma. And it will be with non-Hodgkin's lymphoma that we plan to focus on our future studies aimed at obtaining regulatory approval. So in ending, I'd like to say thank you for your interest in Volition. Thank you for allowing me to share with you these exciting results in blood cancer. And I hope you stay tuned and stay informed, watching for our more recent publications and announcements that will be coming not only in blood cancer, but in everything that we're working on at Volition. Thank you.